Experience is with other tumor types. In the following we present experience gained with several other tumor types. By describing the cases, we wish to demonstrate the efficacy of DD water on the one hand and highlight the characteristics of other tumors on the other. We stress again that results presented here do not exhaust all possibilities of DD water treatment, because the bulk of experience is come from the time when, lacking DD water of a low D content 30 ppm, it was not possible to maintain decreased D concentration for a half-year 1-year period. With 90 parts per million DD water at our disposal, D concentration in the patient's body decreased to 115 to 120 ppm. We are convinced that the cases described below can be reproduced with medical assistance, and in the possession of neuroclinical experiences, the efficacy of DD water can be further increased. Tumors of the lung. Mala patient 62. A DD water from the 21st of April 1993. Budai has Budapest. The condition was diagnosed in 1992. For academy verified an inoperable tumor. After the diagnosis, the patient was given radiotherapy and first consumed DD water regularly between April 1993 and September 1993. During this time, no progression could be traced. Later, the patient gave up the cure because of the pain that appeared 5 to 10 minutes after drinking the water. Following this, the patient lost 15 kilograms until the 15th of March 1994, when, on the advice of his doctor, he took up consuming DD water. In 2 months, the patient gained 4 kilograms. According to the X-ray performed in July, the size of the tumor was corresponding to the state observed 2 years earlier. The patient's asphyxia stopped. He became physically active again. The examination of January 1995 verified the stagnation of the tumor. Bronchoscopy executed in June described cauterization in the tumor area. After this, the patient was in good physical condition. In May 1996, X-ray scan verified regression. The patient stopped the consumption of DD water in a good general condition in August 1996. From January 1997, a renewed deterioration followed. In May 1999, the patient complained of pain in the operation area. Physically, he was active and his weight stable. 7 years have elapsed since the diagnosis and the explorative operation. According to the X-ray image, the tumor has insisted. Mala patient 72. A DD water from the 12th of May 1993. The occur has days. The weakened patient had a relatively small LCM tumor in the upper left lobe of the lung, near the artery wall, verified by both X-ray and endoscopy. After the first month of DD water consumption, the tumor showed a minimal growth, but by January no growth could be verified. The patient, up till then confined to bed, was able to get up. His physical condition improved. He could walk for hours. The patient had been consuming DD water continuously in August 1995. Later, in April and October 1996 and October 1997, he repeated the cure. According to medical reports of April 1996, the tumor had insisted. Because of his hemophilia, the patient was given no conventional treatment. According to information of October 1997, the patient's condition was stable, although 4 years earlier doctors defined his life expectancy to be several weeks only. Mala patient 47. DD water from the 1st of October 1994 to has days. The patient had been treated from May 1993 on with inoperable lung cancer of an epithelial origin. Until the beginning of the DD water cure, the patient had lost 15 kilograms. The size of the tumor stagnated. Later, a minimal regression, and, according to the December 1993 examination, progression was verified. Because of the progression, from January 1994, a change in the protocol was introduced. The patient tolerated the treatment well. His state was characterized by stagnation and an occasional decrease of atelectasis. August 1994. He got his last treatment in September 1994. The control examination in December 1994, performed 3 months after the last cytostatic treatment, when DD water was the only kind of treatment, described a large-scale regression that continued according to the examination results of March 1995. Progression again was detectable in January 1996. The patient died in October 1996, 3.5 years after the diagnosis of the illness. He had been consuming DD water continuously. Female patient 54. A DD water from the 15th of February 1990, 48 Kerhaz days in January 1994. The patient had been diagnosed with adenocarcinoma of the lung. 1 month later she began to consume DD water and had been drinking it continuously for 20 months, until October 1995. During this time no progression occurred. In June 1995 the tumor that earlier had been verified as to be of the size of a man's fist became smaller. The patient was in a good general condition when she stopped drinking DD water. According to our information of September 1998, 4.5 years after the diagnosis with lung adenocarcinoma, she was active and working. The tumor had for years been stagnating after the consumption of DD water. Female patient 46. A DD water from the 29th of September 1994 SOT Pulmonologiae Clinica, Budapest in March 1994, a tumor of 4x5 cm and 1 of 8 cm in size, of a mixed histological type P and cellular plus anaplastic adenocarcinoma was diagnosed. The beginning of the DD water cure coincided with a change in the protocol. Thus the 50% decrease in the volume of the tumor experienced 2 weeks later can be considered to be the joint effect of the two kinds of treatment. Cytostatic treatment ended in February 1995. By March the patient had no more asphyxiation. Her general condition was good. By June she gained 12 to 14 kilograms of body weight. A renewed progression was verified in August. The patient died in March 1996, 2 years after the setup of the diagnosis. Female patient 61. A DD water from the 29th of November 1990, 48 Kerhaz days. The patient had been diagnosed with microcellular lung cancer in September 1994. Cytostatic treatment began in October. The patient reacted well but tolerated the grave side effects with difficulty. She had been consuming DD water continuously from November 1994 till October 1995. Her physical state was satisfactory. She did not show up after this, but from a patient treated in the same hospital we know that she died 4 years after the diagnosis and 3 years after finishing the DD water cure. Female patient 75. A DD water from the 18th of April 1995 Orsagos Koron EDBCS Pulmonologiae in Tezet, Budapest. The patient was operated in August 1993 with adenocarcinoma. The tumor was attached to the wall pleura in the apex. In the center of segmental, a tumor of the size of a walnut was found. This and the hilar lymphatic nodes were removed by lobotomy. The Ca-199 tumor marker value of the patient was increasing from the end of 1994. November 1994. 54.8 ngmol January 1995. 54.3 ngmol February 1995. 74.9 ngmol in the first 3 months of consuming DD water. The patient lost 5 kilograms, and the tumor marker further increased. July 1995. 86.1 ngmol after the increase of the DD water dose. From December 1995 the tumor marker values were as follows. December 1995. 60.8 ml March 1996, 45.4 ml October 1996, 39.4 ml January 1997, 29.6 ml June 1997, 23.5 ml January 1998, 20.2 ml. The patient has been consuming DD water for the 5th year. Lives in a good physical condition and without complaints 6 years after the operation. Mala patient 69. A DD water from the 10th of October 1995. Forensic case or his. Miss Kolk in June 1994. A left side pulmonary neoplasia was verified planocellular, which, during exploration, proved to be inoperable. The tumor infiltrated the pericardium and entwined the main arteries. Because of the size and location of the tumor, conventional treatment had to be rejected. Thus, DD water was the only means of treating the patient. After a 6-month DD water cure, by April 1996 the patient noted improvement in his health. ESR fell from 80 to 6. The size of the tumor stagnated. The blood sugar level of the diabetic patient decreased. His dyspnea lessened. The accumulated residues cleared up from the left lung, and the patient was able to return to his work as a physician. In the fall of 1997, the patient felt well enough to undertake a journey abroad. His state was stable until June 1998, when a slow tumor growth was observed. In July 1998, the patient underwent a myocardial infarction and had dyspnea even at rest. Heart complaints were stabilized with medication, and his tumor showed a minimal growth only. Despite the fact that following the heart attack, he stopped the consumption of DD water and restarted in January 1999 only. In June 1999, the patient had no dyspnea when resting, and X-ray showed a moderate progression. He has been consuming DD water for 4 years now, with only one break in the meantime. The patient regularly coughs up a considerable amount of secretion. Note: with regard to the frequent occurrence of lung cancer, we have described several cases. It is clear from the above that we were able to provide positive examples to demonstrate all types of lung cancers. We were to make a statistical summary. We would see that in 60 to 70% of the cases there was an objective reaction after the consumption of DD water. Survival rates increased significantly, and the tumor could, for years, remain dormant. The case of the 75-year-old patient illustrates well that in remission following surgery, DD water can prevent later recurrence, which would supposedly have happened taking tumor marker values into consideration. Results can significantly be improved by beginning the treatment with 75-85 parts per million DD water instead of 90 parts per million water. This is justified especially in the case of large-size 4 to 5 cm tumors. Tectum female patient 55. A DD water from the 11th of March 1993. Hanvkar has 96 rupees. Sonography made in October 1993 verified 5 liver metastases originating from the tumor of the rectum. The patient complained of severe pain in the liver area, which stopped within days after DD water consumption. In February 1994, the patient had not been consuming DD water for a week. His pains reappeared but stopped again after the renewed consumption of DD water. The patient's state was stable and he was active during the year 1994 and in early 1995. She stopped consuming DD water in March 1995. And died in July 1995, 21 months after the verification of metastases in the liver. Mala patient 65. A DD water from the 10th of October 1994. Bmkar has Budapest in September 1994, originating from a colon tumor. A 3 to 6 cm multiplex metastasis was verified in the liver. Tumor marker values were measured right before the beginning of DD water consumption, the 10th of June 1994. Then 4 months later, the 20th of February 1995. The values were as follows. CEA 959 mol 189.7 mol CA 50 998 vmol 195.8 vmol Ca 242 3069 vmol 324.6 vmol. The patient had been consuming DD water until his death in July 1996. The patient survived 22 months after the diagnosis in September 1994. Mala patient 58. A DD water from the 2nd of July 1995 Orsagos Onkoldrian TZ. Budapest in February 1995. A 60 centimeters section of the colon was removed in surgery. In the liver, 5 to 6 metastases were found, one of which was the size of an apple. The patient was given 5FU plus leucovorin in treatment. According to the control examination in March, after the consumption of DD water for a month, the 2 kidney cysts were not detectable. By May, the patient gained 6 kilograms of weight. CD and sonography in October verified stagnation and the presence of calcified spots in the liver. CT scan made in August 1996 also verified stagnation. From October, occasional diarrheas occurred, followed by significant deteriorating in health. The patient died in May 1997. 27 months after the diagnosis of the illness and the appearance of metastases in the liver. Note: with this tumor type, in the case of distant metastases, we only succeeded in significantly enhancing survival. This tumor type reacts to deuterium depletion very slowly, and 90 parts per million DD water was not of sufficiently low D content to be able to eliminate larger metastases in the liver. It would be of great significance if the patient consumed DD water continuously for 1 to 1.5 years after colon rectum surgery, as a cure could prevent the appearance of distant metastases. With this tumor type and in the presence of distant metastases, it is advised to start DD water treatment with water of 75 to 62.5 parts per million D content. Prostate Mala patient 65. A DD water from the 30th of October 1992 DI Pesticure has the patient was diagnosed with inoperable prostate tumor in October 1992. After the beginning of the cure, be noted an improvement in urination problems. The PSA value decreased even prior to the start of the Fugral treatment. After 1 month, the tumor became impalpable and also operable. But the patient, a physician by profession, refused to undergo surgery. After drinking DD water for a year, the patient has been free of complaints for 7 years. Mala patient 66. A DD water from the 12th of January 1994 Szeged, MJVO Kurhaza in September 1994 for the tumor of the prostate, caused total obstruction and metastases in the lymphatic glands. In October, the PSA value was 83.4 nanograms mol. Following DD water consumption, urination problems stopped within a short time. 2 weeks after the start of the DD water cure, blood samples revealed a 0.99 ng/mol PSA value. This, however, was thought to be erroneous. Therefore, 2 weeks later it was repeated and showed a value of 0.6 nanograms mol. This value decreased by March 1995 to 0.23 nanograms mol, whereas values measured in June 1996 and January 1997 were below the traceable level. The patient had, for the first time, been drinking DD water continuously for 9 months and repeated the cure for 2 to 3 months in 1996. Note: in the case of prostate tumor, it is of great significance that by measuring PSA value, The potentially tumorous patient population can be defined. Based on our results so far, we are of the opinion that if we are able to diagnose the illness in its early phase, with the application of DD water, this tumor type can be cured with great efficacy, without the need for drug treatment throughout the patient's whole life. It would be of great economic significance to test the male population above 50 to 60 for PSA value and to treat cancer patients with DD water. For the time being, the cheap test, some thousand forints test, is followed by a very expensive treatment, approx. 600 to 700,000 forints per year patient, which, in the majority of cases, lasts throughout the entire life of the patient. Not even the United States of America can afford to provide preventive treatment for all men with tumor of the prostate, as this would cost about $100 billion. The application of DD water would make the treatment followed by cheap scanning accessible for everyone. Ovaries, female patient 45. A DD water from 021992 St. Istvan Kraz, Budapest. The patient was operated with tumor of the ovary in 1993. Following surgery, her tests were negative. She had good appetite, gained 4 kilograms and was active and working. She had been consuming DD water continuously between February 1993 and November 1994, when, with regard to the long symptom-free period, she stopped the cure. Results of examinations in December 1994 were negative, but 2 months later complaints in the abdomen appeared. In February 1995, a repeated operation took place. After this, the patient resumed the consumption of DD water. It is to this that we attribute that despite the positive cytological result, sonography turned out to be negative again. In April 1996, recidiva could be verified. The patient died in November 1997 after long struggle, nearly 3 years after the first relapse. After this, we did not recommend to other patients operated with tumor of the ovary to stop drinking DD water even after a 2-year-long symptom-free period. Female patient 52. A DD water from the 4th of April 1996, Peter Feiss and her UK Kraz, Budapest. The patient was diagnosed with tumor of the ovary in the summer of 1995, which, histologically, proved to be a highly differentiated adenocarcinoma. The uterus and the omentum were also affected. After surgery, the patient was given a series of 8 cytostatic treatments, carboplatin, cisplatin, that ended in March 1996. She began to consume DD water after conventional treatment was over and has been drinking it for 40 months continuously. She is active and symptom-free. Note: it is a well-known fact that ovarian tumor is a type of a very poor prognosis. In spite of this, however, according to our experiences, it can be well treated with D depletion. We would like to stress that between prognoses based on our present knowledge and the efficacy of DD water, there is no strict correlation. This means that tumor types that seem hopeless from the traditional point of view may react well to DD water treatment. In the case of tumors of the ovary, we wish to highlight that in some cases a relapse may occur even after remission for several years if the patient stops consuming DD water. Cervix, female patient, 47. DD water from the 22nd of November 1993, Országos Budapest. The patient was diagnosed in November 1993 with an inoperable cervical tumor that was entwined with the ovaries. Beginning from March 1994, when the patient started to consume DD water, her state improved continuously. She gained weight, and the tumor in the cervix was no longer detectable. By June, the earlier stricture of the intestines also disappeared. The patient was in good general mood. Starting in November 1994, the patient began to consume water of a less depleted D content. Results of examinations in February 1995 verified significant progression. We could follow the patient for another 5 months, during which time she did not consume DD water in sufficient quantities, upon which there was a slow regression in her state. This case demonstrates well the connection between the consumption of DD water and the behavior of the tumor, as well as the importance of establishing and maintaining the right dose. Tumors of the tongue and peristom, female patient 56. A DD water from the 12th of July 1992 SCAOT Filor J. Jessetti Clinica. Seged. The patient underwent the first surgery in March 1989 with a tumor of the tongue that had existed for a year by then. In 1990, the tumor receded and the patient was given repeated treatment. The end of 1992, a relapse occurred again. It was then that the patient began to consume DD water. From that time on, the size of the tumor decreased, and biopsy performed in March 1993 did not verify tumorous tissue in the sample. The patient had been consuming DD water continuously during the year 1993 and made a break in January 1994. Subsequently, there was a significant progression of the illness, and another operation became necessary in August 1994. DD water consumption was regular from June 1994 on. In February 1997, another biopsy was performed which again proved to be positive. By increasing the DD water dose, the size of the newly appeared nodes decreased, and their substance became softer. A more significant progression was experienced in the spring of 1998 only, when X-ray verified lung metastasis. Due to the increased dose, the patient coughed up slimy secretion. The tumor in her mouth got softer. The size of the tumor near the esophagus decreased, and the tumor at the ear was no longer sensitive. The patient survived another year and died in the spring of 1999. Altogether, 10 years had elapsed since the first operation. In the first 3 years, prior to DD water consumption, there were 3 relapses. We suppose that by a continuous DD water consumption, relapses of such an extent would not have happened. The next case serves as a good example for the above. Female patient 63. A DD water from the 1st of July 993 Orsagos on Koldry in Tezet, Budapest. The patient had been operated 3 times before June 1993 with renewed tumors of the oral cavity. Then, as the patient refused to consent to the partial elimination of the jaw, she was given a full dose of radiation. At that time, she began to drink DD water. By August 1993, the wound under the tongue had healed. The tumor on the chin softened, and by September, the tumor on the neck disappeared. From a medical point of view, the years 1994, 1995, 1996, and the first 9 months of 1997 went by uneventfully. Then a wound made by an apricot seed would not heal. The patient was given 2 cytostatic treatments in November 1997, and the third was missed because the wound had by then healed completely. The patient, by sustaining her good quality of life, is in excellent physical state and has been consuming DD water for the 6th year. Melanoma malignum patient 51. A DD water from the 17th of November 1994 SOTB6 Clinica, Budapest in July 1994. The patient had a Clark III melanoma removed. The tumor started from a mole on the left side of the abdomen. In August of the same year, block dissection was performed in the left armpit. Following this, the patient was given DTIC and interferon treatment. He had been consuming DD water regularly since the above date and was symptom-free in 1995, 1996, and 1997. During this time, a single operation was performed when, in May 1996, a lymphatic node that had been in the armpit for 1.5 years but showed no growth was removed. The microscopic description of the removed node contains the following. The bulk of the substance is occupied by tumor tissue, forming contiguous fields, frequent dividing formations. Necrosis in the substance of the tumor. The tumor is surrounded by a thick fibrous case. The excision does not reveal the extension of the tumor into the adipose tissue. With regard to the long symptom-free period, we made a break in consuming DD water after more than 3 years, from the beginning of 1998. 1.5 months after the suspension of the consumption of DD water, a lump appeared on the breast of the patient, after which he died without having consumed DD water, in March 1999. Mala patient 46. A DD water from the 20th of December 1994 Orsagos Onkoljuian Tezet, Budapest. The patient had first been operated with melanoma malignum. Later, in April 1992, lymphatic nodes were removed from the armpit, followed by further surgery and DTIC treatment in the spring of 1994. By the fall, metastases appeared behind the ear and also in the liver. This was followed by intravenous treatment. According to the CT scan made 1 month after the start of the DD water cure, 2 earlier liver metastases could not be verified. 2 became smaller and 1 remained unchanged. Further controls March, June, December 1996. February, December 1998 described a gradual regression of the liver metastases, while, according to the April 1999 CT scan, the formerly described small residual lesions are not traceable. Unanimously circumscribed formation is not verifiable by CT scanning. The patient has, since the verification of liver metastases, for the 5th year been active and working. Note: we wish to stress that despite the 2 successful examples mentioned above, melanoma belongs to the type of tumors that react very poorly and can be treated with great difficulty only. We could not achieve any success in cases when week by week newer and newer metastases appear. This observation of ours is in accordance with the in vitro examinations of the American laboratory, according to which the melanoma cell line got adapted to the culture medium of lower D content within 6 hours, while with prostate and breast cell lines inhibition was traceable for 24 to 48 hours. Thus, from the aspect of dosage, in the case of this tumor type, the dose must be increased, that is, D level decreased in the body, within a time shorter than usual. Malignant tumors of the bone marrow. Mala patient 26. IML. A DD water from the 1st of October 1995. Uizo Kurhaz, Budapest in September 1992. Following a feverish condition, hypertrophy of the lymphoid nodes was reported, with knowledge of the histological diagnosis Hodgkin lymphoma, first ABVD. Then, from February 1994, COP treatment was given. In June 1994, examinations verified AMLM4 after 3 doses. In October 1994, the patient refused further chemotherapy. According to blood counts of 3 and the 10th of January 1995, the number of blastoid cells increased in the peripheries. The patient started DD water consumption on the 10th of January 1995, and the blood count of the 31st of January could not verify the presence of blastoid cells. The patient had been drinking DD water regularly till March 1997. During this time, all the control examinations proved to be negative. From January 1998, or some months, he had been consuming DD water as a precaution. His results have been negative for more than 4 years. Mala patient 62. CLL. A DD water from the 16th of January 1996 Del Pesti has the patient was diagnosed with B-cellular CLL in 1992. From the end of 1995 on, originating from his basic condition and increasing leukocyte count, anemia, and thrombocytopenia occurred. The patient was treated with concentrates of erythrocytes and thrombocytes. According to the CT scan, on both apexes of the lung residual fascicles were verified, as well as several lymphatic nodes of 1.5 to cm in the mediastinum. The liver and the spleen were considerably enlarged. The mesentery contained partly confluent lymphatic nodes. The disease was progressing despite conventional treatment. The patient was weak, mostly bedridden, and was constantly losing weight, 69 kilograms. He started consuming DD water in January 1996. In the following 2 months, transfusion was given less frequently. Later, on the basis of his blood count results, the patient did not need transfusion at all. He regained strength, and after 4 months the lymphatic nodes in the neck were not palpable. By the end of the year, abdominal complaints appeared. In January 1997, several enlarged lymphatic nodes palpable also through the wall of the abdomen were removed surgically. In the spring of 1998, further swollen nodes were found in the armpits. The patient had been drinking DD water for 3 months. After 1 year, in May 1999, the patient's weight was 80 kilograms. No swollen lymphatic nodes were palpable, and the patient was in good physical condition. Myeloma multiplex patient, 65. A DD water from the 11th of January 1994 SOT Oktakhorhitsa, Budapest. The patient was diagnosed with myeloma multiplex in September 1994. Prior to this, in March, he had pathologically broken a rib. Cytostatic treatment had been begun 2 months prior to the start of the DD water cure. After 2 months of consumption, by January 1995, the patient gained 5 kilograms of weight. In March, electrophoresis verified significant improvement, and after a further 2 months no pathological deviation was shown. The patient was given the last treatment of the series in July. In September 1996, electrophoresis and blood count were found to be in order. In January 1996, blood levels were normal, and bone scintigraphy could not prove earlier thickenings. Control examinations in September were also negative. In October 1996, the patient took a hot bath cure in Heves. By the end of the cure he felt unwell and had pain between the ribs. In November 1996, a new treatment began. By March 1997, a tumor of a considerable size appeared on the sternum. The tumor was in regression in May, appeared again in August, while metastases appeared between the thoracic vertebrae. The patient was continuously consuming DD water with suspension for some months only. Due to conventional DD water treatment, the patient survived a further 2 years and died 4.5 years after the diagnosis. Note: DD water can, with great efficacy, be used to treat oncological problems connected to hematopoiesis. The consumption of DD water significantly enhances the efficacy of conventional treatment and increases the chances to avoid relapse. Liver Mala patient, 66. A DD water from the 11th of July 1994 SOD1. SC. Belklinika, Budapest. A malignant tumor on mating in the connective tissue of the liver had been discovered in 1985. Until the start of the DD water cure, several operations aimed at decreasing the tumor size were made, and also one closing the blood vessels to block the blood supply of the tumor. In May 1994, because of gastric hemorrhage caused by the breakthrough of the tumor, gastrotomy and an operation to join the stomach with the intestines were performed. Because of jaundice and the fall of blood sugar level, the patient lost consciousness on several occasions. The patient was hospitalized in October 1994 because of extreme physical deterioration, in a practically hopeless state. Sonography in November recorded a tumor of 17 x 21 cm in size. Following the consumption of DD water, the patient regained appetite, gained 3.5 kilograms weight, and was able to walk. He was admitted from hospital in November. Jaundice decreased, verified also by laboratory results. High enzyme values caused by the tumor fell. In February 1995, sonography verified a tumor of 16x14 cm. 1 year after the beginning of the DD water cure, jaundice almost totally disappeared, and the improvement of gall flow was proved by the fact that the color of the stool, which had for years been like clay, became normal again. A significant deterioration of the patient's state occurred in November-December, after which he was unable to regularly consume DD water. The patient died on the 27th of November 1995. The significant improvement of the patient's state from November 1994 on lasted for a year and can be attributed to DD water consumption only, as the patient was not given any other treatment. Neuroepithelium amalgamation T45. A DD water from the 25th of April 1995 Mavkar has Budapest. Severe pain in the back of the patient had appeared in November 1994, upon which LUI Comper fracture was verified, but the origin of the primary tumor was impossible to define. CT scan of March 1995 revealed significant progression, which was most expressed at the level of the ellip vertebra, as compared to the previous examination. The body of the vertebra was narrower by 0.5 cm, a process of a soft tissue density, destroying nearly the whole body of the vertebra, and the right side transversus was spreading towards the spinal canal. Biopsy verified neuroepithelioma. Because of its range and location, the tumor was inoperable. Prior to DD water consumption, the patient had been bedridden. His pain increased somewhat 6 to 7 days after the beginning of the cure, but 3 weeks later no morphine was needed to be given and the patient was able to get up. 3 months later the patient could walk by himself, without using a stick, and was also able to drive a car. He had been consuming DD water till August 1995. No information is at our disposal since that time. Astrocytoma mala patient 29. Astrocytoma 3. A DD water from the 28th of March 1995 Orsagos ID Xibzeti to Manios in Tezet, Budapest following epileptic bouts from 1991. Examinations verified the presence of a brain tumor. The operation took place in January 1995. The patient consumed DD water for 44 months without interruption. During the past years, seizures frequent and strong in the beginning gradually decreased. In the past months, several weeks passed without seizures, or, if they happened at all, they were very mild. Then, after 4 years, from March 1999 on, the former 62 parts per million preparation was substituted for a 100 parts per million one. After 1 month, strong headache appeared, and after another month a quick deterioration was observed. MRI verified the appearance of a tumor and cyst of the size of a fist. The increased dose of DD water could not inhibit tumor growth. 1 month later, 4 days after a successful operation, the patient was able to leave hospital. The case is a good example of the significant role of DD water in the inhibition of tumor growth. The dose had been appropriate for 42 months. But even after 4 years, neither the increase of the D content of DD water nor the decrease of the dose were justified, as within 2 months the patient relapsed. Glioblastoma mala patient 44. A DD water from the 12th of May 1995 Orsagos ID Xibzeti to Manios in Tezet, Budapest in August 1995. A left temporoparietal tumor histologically defined as glioblastoma had been removed, after which the patient was given radiotherapy. In January 1996, half a year after surgery, CT scan verified the growth of the ring-like accretion in the operated area. In April 1996, after the patient had been given contrast material, an inhomogeneous contrast accretion was observed with the slight progression of the remaining tumor. In October 1997, CT scan raised the suspicion of a solid recidiva, 1 cm in diameter. In April 1997, the temporoparietal tumor was approx. 3 cm, and the expansive character increased. In 1997, chemotherapy was given. The patient died after 2 years survival in November 1997. Neurofibromatosis female patient well. A DD water from the 8th of June 1996 Bo. On cohamadrolgia. PEX, the young girl had been treated with opticus glioma, caused by neurofibromatosis, and resulting in amaurosis on both sides. In August 1994, the basic condition caused multiple lesions of the central nervous system, accompanied by decreased hearing, facial, oculomotoric, abducent paresis, and the paralysis of the upper and lower right limbs. Carboplatin VP16 chemotherapy was given, and to assess efficacy, MRI was also made. According to the MRI, a significant expansion occurred. Examinations verified progression. Following this, the patient was given no other conventional treatment. The girl first began to consume, in January 1996, the 130 parts per million preparation called Vitaco available at that time. Then, from August, she started to drink an 85 parts per million preparation. According to the MRI made in November 1996, the size and contrast matter accumulation of the formerly described focus significantly decreased. The regression of the tumor was verified. Since the start of DD water consumption, the girl's ability to speak and move has continuously been improving. In January 1997, she was able to walk unaided. In August 1997, contrasted to the state in November 1996, the tumor's size was half of the original. MRI made in December 1998 showed no progression either. The girl has been continuing her studies as a private pupil for more than 2 years now. Note: in the case of tumors of the central nervous system, we think that DD water can play a role at least as great in the preparation for surgery as later. In post-treatment, with brain surgery, the doctor is often faced with the problem that although he knows that because of the tumor he should remove greater areas, this would affect centers, which endanger the patient's life for cause is significant and permanent disability. Based on our observations so far, it might be advantageous if the patient consumed DD water 2 to 3 months prior to surgery. This would enable the surgeon to remove a more compact tumor isolated from its surroundings to a greater extent. This would also decrease the remaining tumor mass, and the area removed would also be smaller. Post-treatment with DD water after surgery, in the optimal case, selects remaining tumor cells for good. Further positive experiences were gained with the following tumor types: chronic myeloid leukemia, CML, lymphoid leukemia, all neuroblastoma, cancer of the testicles, cancer of the bladder, cancer of the kidney, non-Hodgkin lymphoma, Hodgkin lymphoma, thyroid cancer.